Mary-Louise McLaws. She's an advisor to the World Health Organization and an epidemiologist. Thank you so much for joining us on the program, Mary. It's good to see you. Now, we're hearing about this new wave in China and the reemergence of cases in New Zealand. What does this tell us about COVID-19 and how countries are trying to fight it off?
It tells us that this virus is highly persistent. It's a nasty little virus where it can spread with people who don't appear to be overtly ill, unlike previously with SARS or with MERS. So it's very difficult to eradicate, and we're going to have to be very patient and accept that we have a very long tail in our epidemic curve before we can say that we've actually reached zero. And New Zealand was doing so well. And of course, it has a case. And I think if we look at New Zealand and Australia and China, where we've all done fairly well, the one common thing is travellers. And travellers bringing infection back into the countries do pose a risk to the general community as well. So we're going to have to learn also how to care for them ethically, carefully, but also so that they don't pose a risk to our nearly zero number of cases.
So what do you think the WHO needs to do from this point on to help countries who are on a path to recovery stay on that path as much as possible?
Look, I think with the issue in China is a very important lesson that we teach infection control in hospitals, and we teach it very well. We ask the public to hand hygiene. We tell them to wear a mask when they can't keep their distance. But the one area that I don't think that we've been so good in the community is looking after people who either work in very crowded areas or work in the food industry, as we've seen with this salmon outbreak. Now, we don't think it's caused by salmon. It would be highly unusual. It's also highly unlikely that it was from contaminated water, because this virus, while it's fairly persistent in humans, it can be persistent on hard surfaces. It doesn't like water, and it certainly doesn't like water with any sort of detergent or bleach. So I think we need to put in place some infection prevention and control education for wet market employees, and in fact anyone around the world that works with food and works in hospitality industries.
Now, Mary, just to remind everyone who's watching us today, what can we do to avoid contracting the virus?
Yes. There are many things that we can do because we're the partner with our authorities on how we can keep the numbers down. And one is, if you feel unusually ill, even if it's a mild symptom, please don't go to a public area. And if you do have to go to a doctor or get tested, please wear a mask. Secondly, if you're going out in public and you can't keep 1.5 to 2 meter distance, please wear a mask. Now, we suggest that you wear a really good quality cloth mask to keep the medical masks for the frontline healthcare workers, but that cloth mask should be 3 layers. You should clean it every day with warm soapy water with a final rinse of bleach. And please, hand hygiene as you enter wet markets, as you enter shopping malls or restaurants, and as you leave. And also, cough etiquette is very important. And if you're coughing, please don't go out in public.
All right, Mary-Louise McLaws, thank you so much for giving us that insight as always.